Can't even believe it's legal and they sell it over the counter. I am addicted to Afrin. I have been congested for a year. Nobody should be using Afrin, period, hands down. There's a chemical in it, oxymestylazolazine, that binds itself to the receptors in your nose and inflames the nasal lining. Even when you're not congested from having a cold, your nose is literally swollen shut and you can't breathe without the Afrin.
Wow, that must have been horrible. This is why I don't recommend that people use nasal decongestants. Overusing things like phenylephrine, pseudoephedrine, and oxymetazoline can be really, really bad for your nose, and it can lead to something called rhinitis medicamentosa. This is essentially rebound congestion. If you do use these nasal sprays, you should only really use them for 2 to 3 days max. And remember that they are different to nasal steroids. But after 3 days, your nose starts becoming reliant on them. So they work by constricting the blood vessels in your nasal passageways, and this helps to reduce blood flow and reduce congestion. Initially, it might last for about 8 hours, but once it wears off and the blood flow comes back to your nose as your blood vessels expand and dilate, your symptoms can come back with a vengeance. And that 8 hours between doses will very quickly reduce to the point that you're using every 6 hours, then 4 hours, then every 2 hours, and some people even use them on an hourly basis. There may be a place for them in very specific situations, but I generally advise that you steer clear of them. So please send this to someone who uses nasal sprays.